Hey, everyone, have you ever stopped to think about how something as simple as arranging pillows could literally be a lifeline for a patient with a heart condition? Well, today we're diving into the cardiac bed. And let me tell you, this is way more than just tidying up. It's about using a bed to create a powerful structure of support.
So, the big question is, how can a regular old bed actually help a heart that's struggling? It sounds a little strange, right? But what we're about to see is that this isn't just about fluffing pillows. It's about strategically turning that bed into a real therapeutic tool.
To really get a handle on this, we have to start with the why. Understanding the purpose behind the cardiac bed is what makes the house so much more effective. So let's break down exactly what it's trying to accomplish.
Okay, first, let's get one thing straight. A cardiac bed is not a special piece of equipment you have to order. Nope, it's a specific setup, a technique you use on a totally standard hospital bed to give critical support to patients with heart issues.
It all really boils down to two huge goals. First, and this is the big one, making it easier for the patient to breathe. And second, we want to reduce something called venous return. All that means is we're trying to slow down the amount of blood flowing back to the heart. By sitting the patient up nice and high, we're basically using gravity to give the heart a much-needed break. It's really just simple physics, but applied with a ton of care.
All right, so now that we've got the why down, let's move on to the what. Having all your gear ready to go beforehand just makes the whole process so much smoother for you and, way more importantly, so much less stressful for the patient.
So here's what you're going to need. Most of this is pretty standard stuff. Clean linens, a blanket, and of course, a screen for privacy. But the real star of this whole show? The pillows. You're going to want 4 or 5 of them. They are literally the building blocks for this entire support system.
Okay, now for the main event, the how. I'm going to walk you through this, step by step, all the way from the initial prep to getting the patient perfectly positioned. Let's do this. Step 1 is all about respect and safety. Before you even touch the bed, talk to your patient. Explain what you're about to do. That communication builds so much trust. Then, use a screen to give them privacy. That's totally non-negotiable for patient dignity. And of course, wash your hands and get that bed up to a good working height. Your back will thank you later.
Step 2 is all about laying the foundation. You want a smooth, wrinkle-free bottom sheet to help prevent any pressure sores. A draw sheet in the middle is great for repositioning later. And here's a pro tip. Fold that top sheet and blanket down to the foot of the bed. They're ready for the patient, but they're completely out of your way while you work. Now we're at the most critical step, the positioning. We're going to raise the head of the bed way up to what's called the high Fowler's position. We're talking a steep 60 to 90 degree angle. This position is a game changer because it uses gravity to help the lungs expand. If you've got a backrest, this is the time to slide it in. And then comes the art of the pillows. It all comes down to this number, 4 to 5. And remember, this isn't about making it extra luxurious. This is pure structural engineering. 4 to 5 is the magic number of pillows you need to build that perfect support system for your patient. I like to call this the pillow fortress. Here's the blueprint. You'll take 2 or 3 pillows and stack them behind the patient's back and head to keep them in that high upright position. Then you put 1 pillow under each arm. Why? Well, this supports their arms and shoulders and keeps them from slumping forward, which would compress their chest. And finally, 1 pillow goes right under the knees. This is so important. It adds comfort and it keeps them from slowly sliding down the bed. We are almost there. Step 4 is all about those crucial finishing touches. Check in with the patient. Ask them, are you comfortable? Make sure that top blanket isn't pulled tight across their chest. We want absolutely zero restriction on their breathing. And always, always, always put that call bell right where they can easily reach it. Then, of course, you've got to document what you did. In healthcare, if it isn't documented, it never happened.
Okay, so the bed is made, the patient is positioned, but our job isn't quite done. Don't walk away just yet. Now we need to cover the watchouts. Think of these as the essential safety checks that make sure the bed is doing its job safely and effectively.
This should be your ongoing mental checklist. You're constantly making sure nothing is pressing on the chest. You're checking that their spine is nicely aligned to prevent pain. You are actively on the lookout for any signs of breathing difficulty. And if they're on oxygen, you've got to double check that the tubing isn't getting kinked or blocked by all those pillows. These are your absolute non-negotiables.
So when you step back and look at what we've done, what's the big takeaway? The cardiac bed isn't just another task on your to-do list. When you build it the right way, you are creating a literal structure of support. You're giving that patient a stable, secure space where their body can finally get some rest and their heart can get a break. It's truly an act of purposeful, empathetic care.
And that really brings me to one last thought. We've mastered the physical structure here. We've got the pillows, the angles, the whole shebang. But I want to leave you with this question. Beyond any procedure, what is the single most important comfort that you can provide to a patient who is in distress? Something to think about. Thanks for tuning in.